Excellent. Pardon. Well, welcome to the session of the 2026 Culture Data Conference. Thank you all for joining us. I'm Dennis Wright, he, him pronouns, and I'll be monitoring the session for you. We also have Josh Wells, who's managing the Zoom and making sure the tech is running smoothly. So for now, you're all muted, but if you have a question during the Q&A sessions, please feel free to unmute. You can also use the chat box if you have any questions or if you need anything. If you're comfortable doing so, please add your pronouns to your Zoom name by clicking the three dots on your video square and selecting Rename. For now, we have one presentation during the section, and they'll present for about 25 minutes, and there will be 10 minutes for Q&A afterwards. So for those who may not know, direct cash assistance has been part of a global conversation for a good while now. But more than just an economic discussion, we must remember that health is in everything. So we can't have conversations about supporting one without supporting the other. Now, the work from our speakers today highlights how providing financial support leads to better health outcomes, as guided by both data and lived experiences. Now, far from being a mere handout, their work details a strong foundation designed to lift the constant and cross-cutting burden of financial instability. Now, this lift allows program participants to focus on their well-being and more fully engage with their communities. And I personally, I can't wait to hear more about this work happening in our own local area. So with that, I'll now turn it over to our speakers, Elizabeth Crow, Stu Lepan, and Juliana to present Dollars and Dignity, data and stories about how direct cash assistance improves health. The floor is yours.
Thank you so much, Dennis, and to everyone here. Thanks so much to the Culture of Data team for accepting this proposal. We're very excited to be presenting to you all. My name is Elizabeth. I serve our Boulder, Colorado community as Deputy Director of our Housing and Human Services Department. I'm going to start sharing my screen. And we'll get going with the presentation. And my colleague Stu Lepan and our friend Juliana, Elevate Boulder participant, will be speaking as well. Can I get a thumbs up if people can see my screen? Wonderful. So people feel free to use the chat to answer some questions. We get some interaction during the presentation. We'll obviously leave time at the end for questions. And we also will have a Mentimeter poll. So if you have a cell phone handy, don't look at it now, but just keep it handy for a little bit later in the presentation. Our learning objectives are to look at the Elevate Boulder Guaranteed Income Program to understand what some best practices are for co-designing programs with community members to ensure that programs with health outcomes or any outcome about social determinants of health are integrated with trust and equity. Explore how guaranteed income or direct cash assistance can impact mental health and well-being, and how storytelling in the words of people who are living with the experience, with the pain points we're working to address, can really enhance other data sets to help us understand root causes and successful interventions. So what is guaranteed income? Please put in the chat if you just a yes or a no as to whether or not you've heard of this term before or know something about it. Guaranteed income means, in this situation, unrestricted and unconditional direct cash assistance to low-income households. Guaranteed income projects often utilize both government and various sorts of private funding in order to support. They can be implemented by governments, nonprofit organizations, institutions, or a combination. And it's pretty common in the United States for participants of guaranteed income programs to receive monthly, bi-monthly payments for around 1 to 2 years. Guaranteed income programs in the United States are a little bit distinct from another term we hear often, which is universal basic income. That concept uh, typically means that anyone in a population would receive some level of unrestricted or unconditional income. For guaranteed income, we're really talking a very targeted support for people that have specific identities, such as being low income, or even more specific populations that are experiencing economic disparity. In our Boulder community, and this probably reflects many of your communities as well, we have around 1 in 4 community members living in our city who really struggle to make ends meet. They're having a hard time affording food, housing costs, healthcare, childcare, all of the other basic needs. And it's very, very hard to not only meet those basic needs, but also try to get ahead to a place where they're more financially stable. And we created Elevate Boulder to intervene on that cycle of not ever having enough and really worrying and stressing about not having enough. We started this project wanting to design the Elevate Boulder program with dignity as a core value that would be manifest throughout the program, no matter how people engage with it. We were able to put this program in place with $3 million allocation from the city's American Rescue Plan Act fund. Those were those COVID relief funds that started coming in 2021. And along with our city staff team, we invited community members who live in Boulder with low income to work with us and determine how much money we would give people, for how long, and how frequently, who would benefit from this program, and what kinds of outcomes we hoped would happen, not only for participants, but our community as a whole. We also worked very closely with nonprofit organizations, and in particular, our nonprofit organizations that where the people who lead and staff the organization reflect the identities of the people they're serving. That included organizations serving people with disabilities, our Latino and Black communities, our immigrant communities, our queer communities, and community or organizations that specifically serve families, older adults, etc. Eligibility for Elevate Boulder, you had to be at least 18 years old. You had to live in the city of Boulder, had to be COVID impacted because these were COVID related funds. And we were targeting our low income population that is between 30 and 60% area median income. And the participants that we had in the program really reflected the diversity of Boulder's low income population, which is what we wanted. People who are familiar with Boulder know that we are a community with a predominantly white or people who identify as white as our primary population. And we tend to be a young population, although older adults, like most places in the country and the state and country, that population is continuing to get older. So even with that, we had a spread of from at the time of enrollment, people aged 21 all the way to 81. And we had 15% of people identify as having a disability. We also had, relative to the population, a larger number of participants who identified as being trans. And as the slide here shows, 75% of our participants had at least one child under the age of 18. That's important because with guaranteed income programs, like many other financial assistance programs, when you have a child in the household, this kind of intervention on such a key for so many social determinants of health can really affect the lives of children that could last throughout their lives. So here I'm going to turn it over to my colleague, Stu. And Stu, let me know when you want me to advance the slides.
Excellent. Thank you, Elizabeth. Hi, everyone. I'm Stu LePan. I'm a senior data analyst with the City of Boulder, and I'm going to talk to you a little bit about how we evaluated this program quantitatively. So we worked with the Omni Institute to develop a longitudinal evaluation with mixed methods. This involved a number of repeat surveys given to participants, as well as focus groups with a subset. So starting back in January 2024, we had about 170 participants that agreed to participate in the evaluation process. Starting at the 8 month point, we had a remarkable 82% of participants show up and take part in this. Um, this is really, really spectacular for a longitudinal study of this type, and we attribute that in no small part to the incredible work done to build relationships between our Elevate Boulder staff and participants. We then followed up at the 10-month mark with some focus groups and a final survey at the 20-month mark, where we had, again, a really incredible 75% continued participation rate. Um, Next slide. So looking specifically at the survey element of our evaluation, the surveys covered overall affordability of basic needs, food security, housing, childcare, mental and physical well-being, which we'll talk about a little bit more here in a second, and a variety of indicators related to their financial circumstances. So we looked at things like how it may be impacting savings and debt, but we also looked at other co-determinants such as employment status, education, and ongoing training on the job. Next slide. So overall, just to summarize the results, our participants were better able to meet their basic needs. For some, they were able to decrease their debt. More commonly, what they saw was a decrease in the rate of debt accumulation. Uh, Stress was overall lowered due to the increased affordability of living costs. And also, overwhelmingly, our participants uh, reported that they felt this was a dignified process. So this all translates to improved financial stability, in some cases, increased savings in addition to getting debt under control, reduced food and housing insecurity, and giving our participants more of a sense of self-determination. Next slide. So I do want to pull out a few specific metrics from the longitudinal study. Starting with affordability of basic needs, 76.4% of our participants stated that Elevate Boulder did make it easier for them to pay for basic needs. This chart we have here is looking at the number of items that participants found difficult to afford from a list of basic needs. And what we found was that from the baseline metric to the 8 month mark, there was a significant reduction in the number of basic needs that participants found difficult to afford. And while the difference between the 8 month mark and the 20-month mark was not statistically significant, we did see a continued decline in the inaccessibility of these items. And this change was mirrored across some other measures of affordability, like looking at housing costs and food security. Next slide. So one of the kind of compounding benefits of those trends is the overall reduction in psychological distress. Participants were asked on each of these surveys to rate their distress on a subjective scale. And we found that there was, once again, a significant drop in stress from the baseline to the 8 month mark. And while there's a slight uptick between 8 months and 20 months, that decline largely persisted. We've pulled out a quote here from one of our participants that really highlights how important this is to overall well-being, because uh, while we are just addressing directly the material stressors. The stress that comes from the lack of affordability for basic living needs is a really compounding issue that can be debilitating and further impact someone's ability to improve their situation. Next slide. In addition to the benefit to psychological health, the overall physical health of participants was also impacted by our program. 68.7% reported that their general health was better now when compared to when they started in the program. And this is in spite of the fact that across the board, there weren't really any major changes among participants in terms of their access to health care. There are a variety of ways in which participants reported that this program had this impact for them. For example, we had people better able to afford supplements to their healthcare that were not covered by insurance. And also, something as simple as finally being able to afford a gym membership can have a major impact on someone's sense of physical well-being and agency in taking care of themselves. And this is where I'm going to transition back to hand things back to Elizabeth, because really some of the most powerful information that we collected from this process is grounded in storytelling from the perspectives of our participants. And we'll dive into that here.
Great, thank you, Stu. So, in addition to all of the investment we made in having a research partner like Omni, we know that when we ourselves want to really understand the impact of a program or a project, and we want to be able to communicate that out to the broader public, that it really takes not just the statistics and the data and the dashboards, but people expressing in their own words and in their own way what their experience was and how they benefited from something or not. And we felt the best way to complement the research was to enable participants who wanted to engage in storytelling. And so we were able, with a grant from the Community Foundation Boulder County, to engage 5 different storytelling practitioners or organizations. And those span from video to photography, audio interviews and podcast, essay writing, and also autobiographical narrative. In other words, people who participate in Elevate Boulder wrote their own monologues with coaching and assistance from professionals, and then actually performed those monologues publicly to share about their experience. The image that you see on the right of the screen are just a few of the photographs that participants took. Their only instruction was some tips on how to take a good photograph with your cell phone, and they were turned loose to take photos of images that meant something to them about their experience in Elevate Boulder. And so just with these 4 images, you can see that we're touching on transportation, healthcare, oral healthcare. A mother would not have been able to have her daughter's oral orthodontics needs addressed. A person who really was able to deepen their sense of home in the place that is Boulder, in the outside environment. And a mother who was able to care for her child and their dog when their dog got sick. And we also had, as I mentioned, just one of the storytelling opportunities was around video storytelling. And I'm very happy to introduce Juliana, who is here. And she was an Elevate Boulder participant whose video interview is on the project website, and we'll circulate that information and with some QR codes in the PowerPoint and a link in the chat. But I'm going to stop sharing my screen here and enable Juliana, please, to share a little bit about her story and her experience, and in particular, how receiving these direct cash assistance payments was able to improve her health and that of her family. So, Juliana, please go ahead.
Hola, soy Juliana y quiero compartirles el impacto tan grande que tuvo en mi familia al recibir la ayuda de Elevate Boulder. Cuando yo me inscribí, nos dijeron que nos iban a dar la noticia como en diciembre. A mí me da tanta emoción cuando me acuerdo que recibí la noticia en diciembre, antes del 24, que fue como que respiré, que dije, voy a tener 2 años con más tranquilidad, que vamos a tener un dinero extra aparte del trabajo que nos va a ayudar mucho. Entonces, recibir la Navidad tan, tan feliz junto con mis hijos, pensando que íbamos a tener 2 años de, de tranquilidad y de ayuda. Entonces, cuando recibimos la primera ayuda, fue muy bonito porque nos ayudó para empezar, fue como psicológicamente algo, un alivio, un alivio y cada mes que nos llegaba esa ayuda, salíamos a disfrutar con nuestros hijos. Tenemos 2 hijos, pero sin estar pensando que mañana no íbamos a ajustar la renta porque eran $500 regalados. Imagínate, sin trabajarlos, que nos ayudaban y, y aparte no les estábamos diciendo a los niños, no vamos a salir porque no hay dinero o porque hoy trabajamos mucho y queremos juntar para esto. Fueron 2 años que pudimos llevarlos a pasear, a trampolines, sin estar pensando en el mañana. Otra cosa que nos impactó fue también que nos ayudó mucho para mí en mi comida. Yo estaba un poco pasada de peso y pues el motivo que nunca me había comido saludable era porque el mandado aquí en Boulder es muy caro. Entonces, con esos $500, nos sacó mucho de apuros en nuestra familia porque comprábamos más comida saludable, más vegetales, más frutas. Entonces, fue un grande impacto en nuestra familia.
Gracias, Juliana. We are so fortunate, have been so fortunate to get to know Juliana and so many of the other participants. And when Juliana talked about kind of having that relief or that breath, so many other participants from all different identities and households would say the same thing, that when we are in that constant stressful situation, it's very, very hard to relax. And it's no wonder that so many people in our city, in our state, in our country are experiencing such high amounts of stress that we then have to try to fix. And what happens if we look at solutions or interventions like guaranteed income as something that can enable better health at the same time it's addressing so many of the other social determinants. So thank you, Juliana. Gracias for sharing your story again here. I have a few questions for discussion that we just will put up on the screen and would love to open it up to back to our facilitator for the session. We have maybe some time for discussion and then maybe a little bit of time at the end for a little online poll to see how people were able to learn, and we'd love to hear all of your questions and thoughts about this strategy.
Wonderful. Thank you so very much. This was wonderfully impactful and great to hear not only from the organization, but also from anyone who had someone who had lived experience through the program. That's excellent for us all to hear and helps keep us all grounded. So I will open this up to the group. Let's start with your questions. If you have any questions, feel free to put them in the chat. You can come off of mute at this time and you can ask your speakers your questions. I know I have some, but I'm going to try and make sure that others, I don't, take up all the air in the room. So please. I don't know if you can see this, but we are getting some thank yous and some well-deserved praise for all of the work that's happening here. And while we're waiting for folks to get their nerves taken care of, I would love to start with one of the questions that I know I had, and then would love to get into discussion questions. We still have a few minutes. So one of the main issues that I've seen out in this work facing those who are not financially secure. It's the stigma that somehow their situation is their fault, or if they were just more self-controlled or educated, or just plain if they want it bad enough, that they could get themselves out of the the places where they are. Now, of course, your work here is clearly stating that this is not the case, but I would love to hear more about any efforts you've taken to frame this as like a systemic or structural or institutional issue, and how we're working to help correct the narrative. I will open up for everyone.
Maybe I'll start, and Stu, Juliana, feel free to jump in. Thank you for asking that question, Dennis, because at its core, this kind of approach and many other approaches around financial assistance and basic needs assistance is rooted in trust. That we know that if people are having a hard time affording living in our city, it's not because they have failed. It's not because they are lazy, or maybe, although everyone needs information and help and guidance at some level, including people with resources. But it's mostly about systems, that wages have not kept up with the cost of living, that people who are living on that benefits cliff have to make difficult decisions every day about whether to increase their hours or provide childcare, because you can't do both, or deciding which bills to pay. And now that we're seeing the cuts in federal benefits programs and changes in eligibility, we know that's going to get worse. Guaranteed income tells our community members, we see you and we hear you and we trust you. We think you are the best people to know what you need and how to get it. And what you need is some money, some resources, so that you have that flexibility, that choice in what we hope is a dignified manner. And it's not because you're lazy or somehow not deserving of this. Some of the data that we did collect as part of the Omni study, which Stu talked about, looked to see how many people were working and how much. And I'm sure that people in this session will already not be surprised to hear that around 80+% of people were already working, mostly full-time. And a significant number of people were working 2 or more jobs. We know that that's the reality. And the data bears that out consistently across the board. And receiving these funds did not, as some people believe, cause people to work less, or to say, oh, great, now I'm getting $500 a month. Now I can stop working. That doesn't happen. Number one, impossible to live off that. But what we saw was that people were actually able, when they had that breath and that relief that Juliana talked about, it gives you a little bit of space to think, well, maybe I can do something a little bit different. And so we know of participants who stopped their third job hours or a second job in order to get a little bit of job training or invest in their education or take a different career path that ultimately was helping them be more financially stable. But you can't do that when you're in constant crisis. And so I think it points back, as you said, to that dignity and that trust. And from a starting place where everyone does deserve this, the myth of not deserving is one that we'll hope will continue to go away. Stu or Juliana, did you want to add anything to that or share?
Yeah, I'll just jump in real quick and add, as someone who is trained in the data space and mostly operates in the world of the quantitative, I really do think that the way that this program emphasized personal narratives was really, really advantageous in sort of countering those narratives that you brought up, Dennis. It's very difficult to convince people to let go of prejudices or preconceived ideas they have just by throwing some numbers on a slide. Um, but I still remember the very first personal story I heard from a participant, which was about how she was able to afford throwing her child a birthday party for the first time. Um, those sorts of things stick with people so much more. It and participants are better situated than anyone to speak to their motivations, their needs, and what's guiding them. So yeah, really qualitative data and storytelling really should be emphasized wherever possible in programs like this.
Should we take some of these other questions, Dennis? I don't
Absolutely.
know how much time we have left.
Yeah, but a little bit of time. We can make this work. I'll start with one first question here, and it's asking about the evaluation and looking at the impact on recipients who also received other benefits, which there's definitely something tied there as well. So were there any insights on how direct cash assistance might have complemented or made less necessary other benefits?
Yeah, so we did at the point where people applied to the program, they were able to kind of select from all the different benefits programs they were a part of, and that included some very local City of Boulder benefits that we provide, as well as, kind of federal benefit programs. We did not specifically ask people like, you needed it then, did you need it now? So we don't have that very direct line in the evaluation. But we did get some data on that, certainly qualitatively. Lots of stories about, and some of them are just known by other people in our staff and our nonprofit organizations. Like people were saying like, I don't need to apply for the food tax rebate this year. I didn't need to go for rental assistance. I still received food benefits, still Medicare. I think nobody, or few people we're guessing would have chosen not to continue to get those benefits if they were eligible. This wasn't meant to be a replacement. But we do know anecdotally that it was those emergency assistance services that some participants in households just they didn't need it and they were really happy to not take it because then they knew somebody else in the community who needed it might be able to benefit as well. Um, yeah.
Hmm, that makes sense. Made me think of the donut hole that happens with insurance, where you make just a bit too much above like the 250% for the poverty level, but you're still not making, you're not well off by any means. So then you don't qualify for public assistance versus those who do. But that
Mhm.
also made me think of, thank you very much, Jeff, for the question. Um, because now that we have this guaranteed income, that could have also potentially negatively impacted other services that were provided because now they're saying, hey, you have new income. we don't need to provide you with this from the state, for example.
Mhm.
So I'm sure there's plenty to consider and navigate and make sure that folks are well taken care of. The good news is it does look like the data bore out that this was more of a benefit than a harm. So I think we can just call that a win.
Yeah.
So before I go on, I'd like to ask the next question. And this person is wondering if you have a if shared a cost analysis for this, and it could be a fiscal motivator for policy development. So we're going back to the structural, the institutional level. So that cost analysis might be really interesting. So, what are
Yeah.
your thoughts? What do you have available?
So our research with Omni, we did not look very specifically at some of those community costs, and in some ways because, well, number one, we were trying to have a slim evaluation budget so that we could use most of the funds we had just to get out to the community. But there are other studies on guaranteed income and direct cash assistance that showed, for example, less crime, less recidivism for programs that specifically are targeting people who've re-entering community from the criminal justice system, less hospitalization through emergency room. So there are huge costs, right, to our criminal justice system, to our emergency medical systems, et cetera. There are some studies that look at things like education, very similar to what you find with resources that look at investments in early childhood, childcare and education. So there are those studies out there. Please feel free to kind of reach out if you'd like to see what some of those are. One thing that's also interesting, it wasn't a part of the Omni study, but we were able to gather the data anyway, is that for participants who receive their funds through a debit card, and most participants chose to get like a direct deposit, but for the debit card data, shows that over 95% of the funds allocated were spent or withdrawn, like from an ATM withdrawn or directly spent at businesses within the city of Boulder. So not just kind of even our region, but literally within the city of Boulder. And so when we look at that, I mean, it doesn't get more local than that in terms of just putting those dollars immediately back into community. So we did get that data. Again, it's not for the entire participant population, but it's a really great indicator of what that economic return on investment looks like.
Wonderful. Thanks so very much. That was wonderfully thorough and very clear. We really appreciate it. I did post the group discussion questions. However, I am looking at the time and we are starting to dwindle down, and we do have a couple of announcements we also want to give to everyone here. So I would highly recommend reaching out to our speakers. Thank you very much once again for providing such a great outcome. I mean, my goodness, the retention rate is just staggering. That is excellent. I would have expected 25% easy and been happy. So that was really good to hear. So please contact our presenters if you'd like to follow up with more information. But in the meantime, I just want to thank everybody for attending this session and for the Q&A. Thank you for your questions. There are just a couple things that we need to announce before you head on to the next part of your day. The slides and any additional handouts the speakers have available will be available also on Sched. You will also receive a conference evaluation form by way of email after the conference is over. So please fill that out. Even if you only attended a portion of the conference, it's okay. It is always very helpful for our planning committee. And with that, we can give you an extra 2 minutes. So if you'd like, you can have a 17-minute break before the next concurrent session begins at 1:30 p.m. And there are 3 sessions to choose from at that time. So see the full schedule on the Culture of Data conference website. And with that, Thank you once again to our presenters. Thank you very much, Josh, for tech hosting for us. And this has been a wonderful start to our day. Looking forward to the next sessions. Take care,
Thank you,
everyone, and have a
everyone.
great afternoon.
Thanks all.
Thank you. Hey. All right. That's wonderful. Thank you again
Thanks,
for
Dennis.
giving all that. Oh, thanks
Thank
so much.
you.
Everyone, take care.
Gracias. Bye.
Bye now.